Nyajong.
Nyajong.
Kolumbe Hu'ua Nicole.
Kolube Ho'ua Monica.
Gulumbe Nancy Robles Ortiz.
Kulumbe Hu'ua Susana.
Kulumbe Hu'ua Joanna.
Today we're going to be talking to you about mental health care for Hmong clients. So just before we begin, I just want to emphasize and remind everyone that for the purpose of the assignment, we did change our client's name. So you will see the name Zia throughout the presentation, but just know that we did change her name for the protection of our client. So as we begin, we're going to go over barriers for Hmong mental health services. And some of the things that were brought up to our attention per Zia were her own personal reluctance to seek mental health care, which is something that we see in many of our clients. So imagine feeling the need to hide your struggles because you're afraid of what other people might think, especially within your own community. However, this is a fear that's unfounded. However, it is rooted in real concern about being judged in your own community. Also with that is the fear of stigmatization. So this isn't just about an individual feeling marginalized, it's about their entire family. So in the Hmong community, one person's actions can reflect on the whole family, affecting their social standing and their cultural identity. The fear of seeking help can be a powerful deterrent. Also with that is cultural expectations. There's significant value in maintaining traditions and avoiding turning back on your own cultural values, and this is deeply embedded within the community. There is profound respect for maintaining traditions, including the principle of, like I said, of not turning back on your values. For many, seeking external mental health services feels like a violation of this principle, as if they're abandoning their own cultural roots. And then also is the potential consequences. So when someone steps out to seek help, they risk being seen as unable to uphold their traditional roots and their roles, which can lead to feelings of shame and perceived failure. This is especially difficult in a culture that values self-reliance in handling issues within the community or family. So by understanding these barriers, it's crucial for us to, as we work towards more culturally sensitive approaches to mental health in the Hmong community. It's about creating spaces where individuals feel safe and supported, not just by mental health professionals, but by the community and family as well.
So, identified barriers we found through our interview with Zia were cultural and linguistic mismatches, being the differences between the client and provider backgrounds, culture, and language. The stigma, so they're scared of the negative perceptions of mental health within the community, which can cause a barrier to them reaching out and getting the help they may need. There's also a huge lack of awareness, so in the community, they may not know that there are available services to help them with mental health. This all leading to the consequences of underutilization, misdiagnoses, mistrust of professionals, therefore widening the care gaps.
Our group found 6 proposed solutions to these barriers. The first solution that we found was cultural competence training, so training providers in Hmong culture and language to improve client-provider rapport, community-based outreach, engaging community leaders in mental health education to reduce stigma and promote understanding, bilingual services, increasing the availability of bilingual mental health professionals to ensure language is not a barrier, inclusive policies, implementing policies that respect cultural values and practices within mental health frameworks. We also found awareness campaigns could be helpful, so launching campaigns to educate the Hmong community about mental health, emphasizing confidentiality and the benefits of treatment. We also found that support groups could be helpful as well. So establishing culturally sensitive support groups to provide a safe space for sharing experiences and strategies for coping.
Now that we've covered some of the barriers that were identified by my fellow colleagues, I wanted to dive into the service delivery model. The first one that you see here that we are presenting is the Terry Cross delivery model, which basically just breaks down the cultural competence continuum, starting from cultural destructiveness, which describes the attitudes, policies, and practices that are destructive to cultures and individuals within that culture. Additionally, underneath that, we see cultural incapacity, which is the lack of capacity to help different cultures due to biased beliefs and go against anything that is outside of a mainstream culture. Furthermore, there's cultural blindness, which maintains the dominant culture's approach, very much dismissing any differences within culture and celebrating those. Under cultural blindness, you could see the cultural precompetence, which incorporates culturally relevant, imagery to make the space of a mental health agency, for example, seem more welcoming for the client. Under that, we could see cultural competence, which refers to the acceptance and respect for differences. This is the area where we see a little bit more expansion of knowledge, incorporating some of that information regarding barriers to enhance the service delivery for clients. And lastly, cultural proficiency. According to Terry Cross, this is the standard practice that social workers strive to incorporate in their service delivery. And this refers to the deliberate inclusiveness and regular assessment of responsiveness to cultural needs of staff and people served.
So for our assignment, we actually use an ethnographic interviewing. It is a research method used to study cultures, behaviors, and social phenomena. It aims to uncover detailed information and deepen the understanding within the cultural context. So for example, understanding more about our client's culture. Some common techniques used within the ethnographic interviewing would be asking questions, active listening, taking a passive rather than assertive role, also allowing client to lead the discussion and asking open-ended questions. Another interview that we could also use would be the cultural formulation interview, as outlined in the DSM-5TR, which explores the cultural perceptions of cause, context, and support, and it seeks to understand cultural factors affecting self-coping and past current help seeking. And this concludes our presentation.
We also wanted to take an opportunity to thank you, Social Work Department, as well as our Professor B. Yang, for this Latino Hmong grant, as it has given us the opportunity to learn about cultural barriers, as we previously identified, and how to adapt our service delivery to better support our Latino and Hmong clients. Thank you.
Bonjour.